Hi, everyone. This is Dr. Jacqueline Cortez Salmons here at Transformation Health and Wellness in Anaheim Hills, California. I'm glad you could join us today. We are talking today about a super controversial issue. It seems like anything we touch today kind of is a little bit on that controversial angle. Let me see if I can kind of, I feel like I'm the crypt keeper. That's a little better. We're going to talk today about the benefits of vitamin D and how it relates to thyroid health. Now, a lot of this kind of comes on the heels of sort of my career in conventional medicine. I was in conventional medicine or, just traditional medicine practice for about 12 years. I enjoyed it. I was an OBGYN. I loved bringing forth new life, but it was just kind of ultimately not for me. It was very much, I was seeing 40 patients a day, very fast paced and so forth. And I really enjoy taking the time with my patients in the practice that I've created here in Anaheim to be able to have up to an hour with each patient, really figure out what's going on with them and dissect out what is going to be the best plan of care. Now, whether that's a conventional approach, such as using an antibiotic or using steroid or who knows what kind of medication, like high blood pressure medication, traditional diabetes medications, or whether it's supplementation with a vitamin or a probiotic, whatever it is, or a combination therein, it's really nice to be able to take that time with my patients. So as I've done more and more research, and I really try to read every single day, I really try to educate myself so that I can better educate my patient population. I've really found some really interesting correlations. In fact, yesterday I had a very interesting patient. She was fantastic, but having a lot of struggles. She's gained about 20 pounds in the last year or so, just struggling with energy levels, not quite sure what's going on. She had a history of blood clots, can't take hormones, having heavy bleeding, and so forth. So we did kind of a very vast panel to try to figure out what's going on with her, in and amongst which was a very detailed thyroid panel and vitamin D level. Therein, we found that her TSH was really very normal. It was a 1.89, which is actually extremely normal because for me, normal is less than 2. A normal range for general population is anywhere from 0.4 to 4.5. That's actually normal for men, so not necessarily for menstruating females. So for menstruating females, typically we want that number less than 2. So she was at 1.89. It's fantastic. Her free T3 was like at 2.9. Again, very normal. I usually like it about 3, so she's right there. Not much to tweak there. Her free T4 was at 1.0. Again, I usually like it 1.1, 1.2. Again, not really enough to say like, gosh, you have a thyroid problem here. But her thyroid peroxidase antibodies actually, which I usually check the very first time I'm evaluating somebody. And if they're negative, then I don't continue to bark up that tree, but I kind of like to get an idea of where their body's at from an autoimmune standpoint. Her thyroid peroxidase antibodies were at 54. They should really be at 0. So again, while it was not the worst I've ever seen, it really should be 0. Her body is attacking her thyroid and shouldn't be. So even though her thyroid is functioning very nicely, it's kind of fighting an uphill battle, really, when you consider that it's being attacked on a regular basis by her own body, and we don't have a reason why. And then when we look down further in her lab studies, her vitamin D level was on the order of like 25. Again, which is not horrible. I've had patients like literally functioning, walking into my office with a vitamin D level of 8. Ridiculously low. So she's not awful. So again, in that conventional medical setting, you might look at that vitamin D level and say, like, yeah, it's not bad, just supplement, take a little extra, you might want to take 800 to 1,000 international units because that's what we were taught, right? But really, again, as I've done my research, we find that there is a correlation between low vitamin D levels and a higher level of thyroid peroxidase antibodies. A lot of times in endocrinologists, in my experience, when I've sent these patients over to get an endocrinology consult, they say, well, looks like you have early, thyroiditis, you have a little inflammation, you have a little bit of autoimmune. Really nothing to be done with that until your thyroid is no longer functioning. We'll just wait, we'll follow it. Don't know what to tell you. Nothing to be seen here, nothing to be done. And that's incredibly frustrating, particularly when patients who come to me are very self selecting. They want to do something about it, they want to intervene. We can see the train wreck coming. Let's avert the track now so that we don't wait for disaster to ensue and then try to pick up the pieces later. Let's actually jump on board now, get that train averted so that we can avoid the wreck altogether. So we prescribed her some 5,000 international units of vitamin D, get those vitamin D levels up. Let's check back in those thyroid antibodies in a couple of months and make sure that we're on the right track. So again, another philosophy that I have is test, assess, retest, or excuse me, test, treat, retest. So we always want to retest and find out if what we're doing is working. And if it's not working, then we want to change course. Again, we want to have more than one trick up our sleeves. Necessarily, the answer is not just double down and continue doing the same thing. If it's not working, then we need to switch gears. So I really wanted to kind of address this with you guys today and look at the fascination that I have with vitamin D and how critically valuable this entity is. And the reason why I say entity is it's kind of like a tomato, whether it's a fruit or vegetable, right? So we kind of look at vitamin D the same way. Is it a vitamin or is it a hormone? Interestingly, we can actually synthesize vitamin D on our own, which is why some people don't consider it a vitamin. It's actually considered a hormone. Do we synthesize it on our own? Not really. We kind of suck at it. And we sort of suck at it because we're not in the sun enough. And when we are in the sun, then we're very, very good with our skincare. Ta-da! I can credit my mom with my skin. I have nothing to do with this. Thank you, Mom, for the genetics. But that being said, when we go out in the sun, we use our sunblock. We try to block with hats. We want to avoid cancer, and I still recommend that, right? So we're blocking our UVAs and our UVBs, and we have windows that block UVA and UVB. Well, we need that UVB actually to get into that deeper layer of our dermis in order to actually synthesize vitamin D. So if we're blocking that with sunscreen, then we are actually not synthesizing our own vitamin D. So that would be why we need to supplement either through foods, which is usually fatty fish, which again in the American diet, not so much. We just don't eat a whole lot of fish here. We love our sushi, don't get me wrong, but probably not in enough amounts to really account for the levels that we would need to supplement enough vitamin D to get us to optimal levels, right? So better to supplement for the most part. So anyways, we would synthesize through our skin, through that sun exposure, and then it goes to the liver and gets converted, then goes to the kidneys and gets converted again into its active form. So it's a very fascinating type of vitamin, or again, hormone, because we actually synthesize it on our own. That being said, so definition of a hormone is that it's synthesized in one organ and has activity in another organ. So where does it have activity? Well, we actually discovered it in the 1930s. So 1931 for vitamin D2 and 1935 for vitamin D3. Did I get it right? Yeah, I wrote down some little notes. Because we were discovering rickets for little kids, little babies that were having these bowing of their bones. They were very bendy, bow-legged kiddos. They were breaking. Our kids were breaking. Oh my goodness. So we were trying to figure out what the heck was going on with these kiddos, and we found that it was associated with a vitamin D deficiency. And primarily also breastfed kiddos. So when moms were vitamin D deficient, kiddos were vitamin D deficient. They were having bowing of their bones and like not great bone modeling. So that's how we discovered it. So we were like, oh, okay, so vitamin D, bones. So we have vitamin D receptors on our bones. So vitamin D equals bones. And that's kind of where we left it. Actually, for a number of years, we didn't really realize how much activity vitamin D has. So even when I was in medical school, which was about 150 million years ago when the dinosaurs still roamed the earth, according to my kids, then we still pretty much were taught vitamin D, calcium equals bone strength. Next vitamin, please. So if you get the question on the test and it says, what vitamins do you need to take in order to support, osteoporosis or rickets? Rickets equals vitamin D. Next question. That's it. Answer B, done. Or all of the above, done. So that's kind of where we left it. And again, a lot of times because we're so busy in conventional medicine, we may or may not, depending on our specialty, really go back and revisit the literature to find out what's new, what gives with this vitamin/hormone, what do we now know? We're also taught like, hey, 800 to 1,000 international units. Also, other little factoids, it's a fat soluble vitamin. So, by the way, if you're drinking milk, so you can have your vitamin D, but you're drinking non-fat milk, news to you, there's no vitamin D in there. It's, again, a very fat soluble vitamin. So, it is not going to be in a lot of other meats other than like fatty fish, right? The vitamin D3, I want to say, is in the red meat and fish, and then D2 comes from fungi and certain plants. Interesting stuff. So again, some of those like weird test questions that one professor is going to ask. So interesting, but again, not all that utilitarian for all intents and purposes. So we're sort of taught that you're going to give people 800 to 1,000 international units. Vitamin D is an epidemic. We should also be treating kids, pediatrics. Ask your pediatrician what that dosing is. And you can actually get vitamin D toxicity. So that is real. It does happen, but it is actually in practice very, very rare. Okay, so our body does store vitamin D, but it is exceedingly rare to see vitamin D toxicity. So we're not kind of taught that. We're just taught, hey, you can overdose on vitamin D, so beware, don't overdose your patients. The end. So again, how do you avoid overdosing your patients? Retest, right? Give them a dose of vitamin D for a time, like let's say 8 weeks to 12 weeks. Retest. Again, we have people running around with levels of 8 and 12, which is horribly low. Again, the normal range, low end of normal is 30. And that's the low end of normal that was established that we know if we are below that low end of normal, we get rickets, meaning that our bones deteriorate. They are horribly modeled. Okay, we don't have the scaffolding to actually support our body weight when that level is below 30. So that is by no means optimal, right? That just means you're not breaking. Okay, and then you're at like half of that because you're at 12 or 15. Okay, so you're nowhere near toxicity. Okay, nowhere near. Then what they deemed as a toxic level is generally 100, depending on the lab you use. Some are as low as 72, but really about 100 typically. They actually designated that because the pharmaceutical companies back then or the lab companies back then in the 30s, 40s who were establishing these levels were nervous about vitamin D toxicity. So actually they found that you really didn't demonstrate toxic effects until a level of about 300. They wanted to have a cushion, so they designated those levels at 100 so that we would have this cushion between 100 and 300 to have wiggle room, that if somebody were like actually at a serum level of 105, 110, that they really wouldn't die from vitamin D. Right? So look up the statistics. I haven't had a chance to, but vitamin D toxicity deaths are really not rampant, particularly not in the United States. Okay, so vitamin D deficiency, however, leads to all manner of ill outcomes. Okay, so something to look into for sure. That being said, so coming back to its effects on thyroid, what I found interesting in my studies is that we know that when we have lower vitamin D levels, we see worsening effects of hypothyroidism, but also hyperthyroidism, which doesn't get a whole lot of attention, right? I had a very dear patient in my practice who actually just wanted to be seen because she was having some marital issues. She was just very anxious, very high strung. Everything was a crisis. She just kind of knew she was very gripey. That wasn't the word she used, but that's the word we'll use for YouTube. And she's just like, God, I'm just really anxious. Like, I don't know if I need to go on a medication to kind of calm me down, but like I'm arguing with my husband all the time. I was just told I'm kind of this way. I really don't want to go on an anxiety medication, but I kind of don't know what else to do at this point because I just want to save my marriage. I want to have a family, but I certainly, knowing how hormones change during pregnancy, I just certainly don't want to be like this, even worse. How can you help me? Can you check my hormones? Can we see what's going on? Well, of course, sure, let's check. She had fulminant hyperthyroidism. Nobody had even checked. She had been to her primary care doctor and she said, look, I can't gain weight. I eat all the time. I'm never quite full. I'm anxious all the time. I don't sleep well. She had every single symptom of hyperthyroidism. And they said, no, this is just the way you're built. Look at you, how lucky you are to have fast metabolism and you just have an anxious personality. That's what she was told. Nobody even bothered to look at her numbers. So when we did our looking to look at her hormones, of course, as part of that, we always want to look at her thyroid, particularly if she's considering pregnancy, because thyroid disorders during pregnancy can be devastating to a pregnancy, not only for the developing fetus, it can lead to miscarriage, it can lead to poor outcomes for mom. So we definitely want to look into those things. And we found fulminant thyroid disorder. And once we got her on appropriate medications, she did great. Marriage saved. Ah, it's fantastic. So she did very, very well. And it was just a misdiagnosis because a missed diagnosis, not a misdiagnosis, because nobody looked. Right. So with that, then again, looking at those vitamin D levels, ask what your vitamin D level is. Do not accept an answer of it is normal, because normal is different for different people. It means different things from a doctor to a patient. Okay. Normal from a doctor's mouth typically means you are not dying of something. Okay? It means you don't have cancer. It means you don't have rickets. Okay. So it is in the normal range, but it does not necessarily mean that you are optimal. Okay. So optimal range for vitamin D, again, from my studies, what I can gather, it's again very variable. It's kind of controversial out there. It's hard to find studies that are sort of collaborative. But from what I can see, usually it's about 70 to 80 is where I'm comfortable with my patients being, where they're getting optimal thyroid function, where they get optimal autoimmune function, decrease in their body aches, decrease in their headaches and migraines, decrease in all of these other issues that they may have. Now, is it a cure-all? Absolutely not. No, I'm not going to say I'm going to cure your cancer if we get your vitamin D levels optimized. Absolutely, I'm not making that claim. But why not fix your vitamin D levels first, in addition to doing other traditional management as well? Like, will we also put you on thyroid medication? Certainly, yes. Okay, so that's kind of how we want to approach things. So ask what that level is. So if your doctor says you're normal and your level is at 31, I would still recommend going on vitamin D. Okay, and you want to take a vitamin D3. Generally, you want to take it with K, vitamin K, which is also a fat soluble vitamin. So difficult to find when we're all kind of on like low fat diets and that kind of thing. So just take it in the supplement. Oftentimes, they're now being packaged in the same capsule together. So relatively easy to find. And just again, check with your physician about the levels. And you want a doctor who or a provider who is well versed in these levels. Again, I usually recommend in my practice with my patients who are being monitored about 5,000 international units a day. That's because I am also following them up and making sure that those levels are appropriate a couple months out, that they're tolerating it well, that they're taking a good multivitamin, that they are also on probiotics, because we also want to make sure that they're absorbing appropriately. I have patients who are on 10,000 a day and they are still deficient, but they're also deficient in B12, they're deficient in B5, they're deficient in iodine. I have never seen so much iodine deficiency. Why? Because I never checked. I never even looked. For the 12 years I practiced medicine in the conventional world, I never one time checked an iodine level. I now started checking them here in this practice, and I have found no less than 15 iodine deficiency patients. Why do we have iodine deficiency? Nobody's eating iodized salt anymore, right? Because we all have our pink Himalayan sea salt. It's fantastic. It's just great, again, and it's nice and healthy and it's pure, but it does not have iodine in it, right? And nobody's eating iodized cereal because we're all on very low carb diets, right? Nobody eats cereal anymore. That's good, again, but we're not getting our iodine. Where do we get iodine? Usually fish. We don't eat a lot of fish in the United States. So again, do we need iodine supplementation? Sometimes, but somebody needs to check that. So again, sometimes it's not the fault of the thyroid that the actual organ itself is not working. It's that we're not giving it the building blocks that it needs to create the hormones that we need to function appropriately. So we have all these patients running around on thyroid medications when really we're just not supplying the organ itself with the tools that it needs to build the hormone itself on its own. So again, these are all important things to be looking at as you're dealing with your provider. So make sure that as you're dealing with your provider that you're asking for a copy of your labs, look at those numbers, make sure you're dealing with somebody who actually is well versed in literature offer up some of the literature. Again, I'll try to make the citations down below with some of the stuff that I reference. I don't just pull it out of the clear blue sky. I'm always like looking at new studies. Sometimes old studies are beneficial. I know a lot of things are very charged right now and controversial, so I try to pull things from 2015, 2017, 2012. Heck, even from 1988, 89, just because it's old doesn't mean that it's not relevant. And sometimes you like to see trends over time. What have we learned? And we find in medicine, oftentimes things are a pendulum. What is old becomes new again, and really the truth will be somewhere in the middle. And I think if we can sort of stay fluid and stay with an open mind, then we kind of come to what is going to be best for our patients, honestly. And for me, it's not about ego. It's not about being right. It's about what's best for my patient and what makes you well. So hopefully this helps. Again, just something to look into for you yourself. Make sure that you're looking into these numbers as you're dealing with your provider. If you have a concern about a thyroid issue, make sure that they're also looking at that vitamin D. Ask them if they can run a quick iodine level. Again, it's not complicated. It's really not all that expensive. And get the full picture of what's happening with your thyroid, so that you can get the best care and get the best recovery for you, and you'll be feeling better in no time. All right, take care, and we will see you next week.